Hi, I'm Dr. Manoj, surgeon from Sukam Speciality Clinic. India is the diabetic capital of the world. Roughly about 70% of the adults in India are diabetics. Diabetes is one disease which does not spare any organ. The organ that I'm interested as a surgeon is the skin, especially the skin covering the foot. This skin in diabetics, because of microangiopathy, which is loss of blood supply, because of neuropathy, peripheral neuropathy, which is the lack of sensory supply, sensations in the foot, and because of excessive sugar in the blood, can lead on to small ulcers, what is called as diabetic foot. Now, how do we identify this and how do we prevent it? Prevention is more important as treatment is a long-term process. The first and foremost is strict sugar control. Now, if your sugars, fasting sugar is less than 100, if your postprandial is less than 150, and if your HbA1c is around 6.5 or less, that itself will make sure that your blood vessels and the nerves are normal. You won't have, even if you hurt your foot, you will identify it and we can treat effectively. The second idea is to wear footwear inside and outside the house. What we advise is have two sets of footwear. One footwear for wearing it outside the house and one footwear for wearing it inside the house. What kind of footwear do we suggest? The footwear with a thong in the center is to be avoided. Footwear which covers the entire foot, which does not go in between the web spaces. That is the kind of footwear that we are looking for. The sole of the foot, where the foot rests, has to be made of microcellulose rubber or any of the synthetic materials which are soft and which are not hard. The idea is to prevent callosity or corns from being formed. That is the starting point of the diabetic foot. Every day while taking bath or at least while going to bed, it's imperative to have a mirror and to inspect the foot to make sure whether there are any ulcers, any cracks which has recently developed. If ignored, this is where infection starts and can proceed inside the foot. If we take care of our foot as we take care of our face, diabetic foots can be prevented. Thank you.